Hey, Adni fam, it is Anthony. I am honored today to be joined by Dr. Anne Siegmund, who is a senior nurse scientist at Cleveland Clinic, as well as the chair of the Cleveland Clinic Nursing Innovation Summit. And if you've ever listened to the Adni Huddle podcast before or ever seen any Adni content, you know that I am such a big advocate and, really someone who's so passionate about nursing innovation and making sure that all healthcare workers know their innovative abilities. So, Dr. Simeon, thank you so much for joining us on the podcast today.
Thank you for having me, Anthony. I appreciate it.
And you have such an incredible background, both as a nurse scientist and as a nursing leader. So, for everyone listening to the podcast, the question I always love to ask first is if you could just share a little bit about your nursing career journey with us and tell us how you got to where you are today.
Absolutely. My nursing career began about 35 years ago. I went to nursing school I had three kids, so that gives you some idea of how old I am. I worked in several different clinical settings. I started with labor and delivery, I did medical surgical, moved to home health and hospice, and then later to public health. And public health kind of led me to this fascination for prevention. So I was interested not just in primary but secondary prevention. And from this point on, my nursing career took kind of a non-traditional path. I wanted to focus on these two important constructs, the primary and secondary prevention. So I took a certification exam. I studied for a long time to be a personal trainer. And I thought, well, this is going to work great. And I did this for about 10 years. I trained people, mostly older adults, who had chronic health conditions. And they seemed so reassured to have a nurse teaching them how to properly exercise. So
Mm.
I had a lot of fun with that. At the same time, I also taught nursing clinicals and I was also teaching courses in nutrition and fitness. So I think over time, this just became so important to me that I wanted to learn more about it. So I went back to school and I got my master's and then I got my PhD in exercise physiology.
Wow.
So my first job after obtaining my PhD was as an ambulatory nurse, and then I became a certified clinical exercise physiologist, and I was working in cardiac rehab at Cleveland Clinic. So I began researching this population a little bit too, because, PhD focuses on research, and I'm like, I really want to use these skills.
Yeah.
I did a little bit of research on this population. Found out a lot of them were not just heart patients, they had a lot of comorbid conditions.
Mm.
So I fell in love with research at this point. And I ended up applying for a position in nursing research and innovation, and I've been there for nearly a decade. It took me a couple tries to get the job because it's very strict criteria, but I finally got it. And
Congrats.
I just have loved every minute of it. So innovation was a new experience for me, which is part of my job. And over time, I realized that nursing research and innovation are really like two trains on the same track. They
Mm.
intersect. One often requires the other. They're not as different as I thought they were. So when I had an opportunity to chair the Nursing Innovation Summit, that was a really welcome challenge for me. And I started doing the summit, I think in 2016. We had to cancel a couple of times through COVID. We really didn't feel like virtual would work during that time because it's such a hands-on kind of thing.
Mm.
So I started doing the summit, and it's just been a blast and a very educational experience for me.
Wow. Well, congratulations on such an amazing career. there's so much to unpack here, and I'm so excited to dive a bit deeper. I think the first thing that really stands out to me about your story that I think is so empowering to hear as a nurse myself is, how many different paths you can take as a nurse. I think that is something that is so special about the nursing profession is it's really such a versatile degree in that, you can work at the bedside, you can do public health, you can go get a PhD, you can do innovation. Like your
Right.
career has really touched on so many different aspects of, all the things that nurses are capable of. One thing that I'm curious to learn a little bit more about is, your journey going back to school for your master's and PhD in experience. I think you said physiology,
Exercise physiology.
exercise physiology. That is just so unique because I feel like I'm sure your nursing background as like a bedside nurse probably brought so much kind of useful experience
Mhm.
into that research you've been conducting. So I'm curious to learn more from you. How did you feel that, one, going into the PhD world might be a little bit scary. There's probably a lot of nurses listening that have maybe thought about it, but scared to take the leap. And then two, how did you feel like your nursing background kind of prepared you for those programs and the perspective that it brought to your work?
Yeah, it brought a lot of perspective. And I do think that my nursing background was good preparation in a way for the physiology part of it. I ended up having to take 7 doctoral level physiology courses, which was just brutal.
Wow.
But it was so interesting. And as I was going through those, I could apply that to the patient population. And I was more interested in, like I had said before, the prevention. And so using that knowledge of um, physiology in the sick patient wasn't quite where I was at first. At first, I was kind of using it as how do I prevent people from getting into the bed in the first place, in the
Mm,
hospital bed? And then I realized, as I was working in my business where I was training people and as I was teaching, I thought, boy, there's a lot of secondary prevention out there. Now I've come full circle and my research is focused on frailty and, specifically people with Parkinson's, heart failure, people who are quite sick and oftentimes hospitalized, and even looking at tertiary prevention. So now I'm seeing where physical activity is not just exercise, right?
mm.
It is any kind of movement, any kind of mobility, and it saves lives. It's the medicine that has no side effects, really, if it's done properly. So that's really where the two have meshed. I'm not sure if I answered your first question. What was that?
I guess just trying to hear a little bit more about, how you kind of jumped into going back to school and continuing at your education.
Yeah, initially that really was just an interest in learning. I just wanted to learn, and I just loved the topic. And I still do. I still find that exercise is the best medicine that there is. And in that way, it has meshed with my nursing career extremely well. I have not known of any other registered nurses who were also exercise physiologists,
Yeah.
but I do find that those two things go so hand in hand. I saw that firsthand when I was training people, and then later when I was working in cardiac rehab, where in cardiac rehab I could change gears. I could be the nurse. I could be helping someone who was having chest pain during their physical activity, or I could
Mm.
shift gears and be the exercise physiologist. And in most cases, I was both. So it really it meshed extremely well for me.
Absolutely. It really comes down to that passion. I think that is
Yeah,
so important in finding your passion in
absolutely.
healthcare and beyond. I feel like there's so many different parts of, healthcare. And I feel like if you can kind of find your niche, and then leverage your nursing perspective, it can be really, really powerful. Um, and honestly, I feel like in nursing school, we need like an exercise class or something to kind of learn a little bit more about that. Because thinking back to my personal experience, going through nursing school and becoming a registered nurse, I don't really feel like exercise was talked about enough.
And interestingly enough, that you say that, our our physiology, the way everything works, changes dramatically when we
Mm.
start moving. And so
Mm.
we're taught to take care of people who are laying there, right?
Yeah.
But a lot of the healing properties don't kick in until we start moving them. So
Mm.
I can't agree more. I think 100%
Yeah.
you need to learn a little bit about um, physical activity, and exercise physiology is also called work physiology, meaning we're doing physical work,
Right.
and it changes the way our body works. Absolutely.
It's such a great point. Yeah, I mean, I think back to the bedside and like just patients that were in the hospital for, a long time. I mean, they really are not getting the proper physical activity that obviously they should be getting. And I, would see patients literally laying in bed for weeks, even
Right.
though they, weren't facing any, challenges that would technically prohibit them from even walking around the unit. But I don't really think the hospital is necessarily designed for encouraging patients to
Right.
walk around.
And I don't think staffing is always there. I mean, that
Yeah,
can be an issue too. So
yeah, really
that's where family
interesting work.
members can come in and
Mm.
be helpful.
Yeah, wow, that's really fascinating. It's super interesting to think about, and I love your work is in that space. It's really fascinating. Would love to also dive deeper into the fact that you actually owned and ran a small personal training business.
Mhm.
I think that one thing you mentioned is, really how kind of research, innovation, nursing, it kind of all goes together hand in hand.
Right.
And I think that really of entrepreneurship as well, and like starting a business or getting something off the ground. And honestly, being a researcher, I think is very entrepreneurial in nature as well, because you have to
Yes.
identify a problem, you have to create a hypothesis, you have to go out there and collect data, and then you have to
Well
create a
said.
solution or, some sort of kind of call to action. And by the way, that's the same process that is the nursing process. You assess, you diagnose, you implement, you evaluate.
Right.
And it's the same as entrepreneurship. They kind of all go together. So I'm curious kind of how your nursing background played a role in you being able to actually start your fitness and health education business.
Oh boy, that really just took a lot of guts, quite honestly. And and some things like that can be frightening. I think innovation can be frightening, but sometimes once you start dipping your toe in the water, you're ready to dive in the deep end because it gets really fun and exciting. So
Yeah,
that that really was it for me. I just had to say this is important to me and I have to do it. And so I did it. And it really wasn't as hard as what I thought. There could be some busy times, there could be financial struggles, there can be different things you have to overcome,
yeah.
but it really is just a matter of just doing it. And it was important to me. So if it's important to you, you're going to find a way.
Absolutely. It's all about that grit and growth mindset. And,
Yeah,
it's, you kind of just have to go for it, which definitely is scary. I think you're right. Innovation is scary, but I think, yeah, if you're passionate about it and you take the leap, you will find that it can be very fulfilling.
sure.
So, would love to pivot to learn a little bit more about your work at Cleveland Clinic as the chair of the Cleveland Clinic Nursing Innovation Summit.
Mhm.
This is something that stands out to me so much in your story and impact because I think really empowering, frontline healthcare workers, nurses to realize their innovative abilities and providing a space to talk about innovation and actually help nurses become hands-on is so important. So, share a little bit more about that work and some of the impact you saw from it.
Yeah, so our Nursing Innovation Summit highlights our internal as well as national and international nurse innovators. When they share their stories, this really inspires the nurses who are in the audience to find innovative ways to solve problems. I mean,
Yeah.
It's overall tends to be mostly inspirational. However, we do some hands-on, and I think, the ideation sessions where we help the attendees find ways to come up with solutions or at least find ideas for how to get started. These sessions help the nurses to take these ideas and take them to their home hospital, and they know that they can make changes there because they've gotten a really good head start, and we've kind of helped to get that going for them.
Yeah.
One of the things I do know, though, is the attendees who are from Cleveland Clinic, we have um, a process and a department for these nurses who come back to us and say, I did this at the Nursing Innovation Summit. I got this idea. What do I do with it?
Mm.
So, my message to other hospitals is to find some way to support these nurses. It doesn't have to be where you have a whole nursing innovation department. We have an Office of Nursing Research and Innovation. We realized long ago those two go together.
Mm.
But if it's even if it's just one person, where they can come back from the summit and say, I've got this idea. What do I do with it? If there's one person who their main job is to help these nurses move forward with their idea and kind of help them get on their innovation journey, because there's a lot of different things that have to be done from not just ideation, but how do I create this product? How do I market it? How do I um, go about getting a patent, things like that. You have to have some infrastructure in place, or at least a person who understands enough of these processes that these nurses can take these ideas from the Nursing Innovation Summit and move them forward.
It's so amazing and so important. And what a
Yeah.
great way to engage, your nursing team, right? A great way to empower them.
Oh,
And I
yeah.
think that that is a theme that is, really more important now than ever is,
Right.
how hospitals can better engage their nursing staff, make them feel a part of the team, make them feel empowered and valued. And I think that innovation is really such a innovative way to do that, pun intended,
Yeah.
because, you're really helping nurses realize that they have the most vital perspective, in the hospital. They are seeing things boots on the ground, front row, and therefore can often, find the challenges and problems that exist in healthcare better than anyone, and therefore
Sure.
create the best solutions. And I think that benefits everyone involved. It benefits the patients, it benefits the healthcare workers, the
Yeah.
hospital, the payers, and more. So it's so amazing that you guys have created that summit. And I love that there's a department to support nurses and even just having those stories of kind of inspiration, I think goes such a long way.
It does.
Um, so with that, talking about innovation, I guess I'm curious to hear your perspective as someone who has, been a part of so many different aspects of the nursing workforce. I'm curious how you feel that technology will kind of continue to make an impact on nurses, workflows, on patient care in the hospital. I feel like there's so many kind of interesting conversations happening around AI and innovation. I feel like there's a lot of these buzzwords, but what are you seeing kind of in your perspective as how technology can make a difference, and where do you kind of see it going in the near future?
Yeah, I think AI is so huge, and we do have nurses in my department, nurse scientists who are researching AI. It's not my line of research, but it's going to be involved in everything. So down the road, we kind of have to embrace it, right? It's going to be there. So when it comes to innovation, I see AI taking some interesting roles. One of those, I designed an algorithm a few years ago that was meant to capture clinically relevant incidental findings. So, for
Mm.
example, this was just an algorithm. And the problem is, in this case, incidental findings like on an X-ray, for example, or CAT scan. Maybe you're just looking at someone's back and you see a tumor. It may or may not show up on the report, so it may or may not get followed up on. And unfortunately, nationally, we see where a lot of them are not ever followed up
Mm,
on. So my algorithm was designed to ensure that they were reported, that they were followed up on, that there was no way for it to fall through the cracks where it
wow.
could just spread if it was a cancer and no one knew it was there in the first place. So that algorithm I took to our radiologists and some other stakeholders, and now AI is being used to ensure that incidental findings are never overlooked. They are always reported, and it'll
Wow.
come out on even on my chart, which is our little hub where we speak to back and communicate back and forth with the hospital, patient to hospital, patient to provider. So I can open up my X-ray report and it'll show right there, there is an incidental finding and it'll
Wow.
describe it. So AI has played a very big role in that. And I see it really playing a huge part in just about everything that we do. But that's just one example where it's going to improve patient care and we can use it that way. We have to be careful, obviously, of all of the downfalls. And I think we're aware ahead of time, or at least a little bit afraid of what AI could do. But just being aware of that is good. And I think we can use it to our advantage.
I think that is so well said. And um, I think having nurses' voices a part of those
Absolutely.
implementations and developments, as you mentioned, like you being able to actually help develop that algorithm, I think is so important because I feel like in the past, without having that nursing voice, it can really kind of hurt the implementation, especially as it gets to front line. So having nurses be a part of those processes and those innovation discussions, I think is so important, especially
Yeah.
with AI. Amazing. Well, we always love to end the podcast with kind of the same question for all of our guests, which has to do with unity. And something that we're certainly passionate about at Adni is really just unifying the healthcare workforce, kind of really just spreading that empowerment and those good vibes and, really having healthcare workers support healthcare workers. So I would love to hear from you. Why do you believe that unity in healthcare is potentially more important now than ever before?
I think it's more important than ever before because of nurse turnover, nurse burnout, some of these things that are hot topics. There's certainly topics that I've researched along with my mentees. Nurses are very interested in these topics. And we used to say back in the day that nurses eat their young, which was kind of a cruel way of saying the more experienced older nurses are kind of mean to us. So we don't like to use that language anymore. But I do believe that now we understand that we need to nurture our young. Experienced nurses have an opportunity to enable a stable workforce through mentoring. And we can certainly see that in one study that I mentored. So I'm the last author on the publication as the mentor. That study, the nurse was looking at negative acts, so negative behaviors. Sometimes it's bullying, sometimes it's not. Sometimes it's a little bit more subtle than that. But we found that nurses who perceived negative acts in the workplace were much more likely to leave their jobs. So it is one of those things that kind of pushes nurses out, and we have to be aware of that. We have to be on our toes and say, we've been here a while, we're experienced, we're mature, whatever we are, we have an obligation to these young nurses, these new nurses, even nursing students who are coming to do their clinicals, whatever it might be, to show them the way, to help support them, offer them answers, and also listen to them because they have the newest and the best ideas where maybe we're holding on to some old ideas that should not be held on to because they're not evidence-based. Our newer nurses understand evidence-based practice, right? So they understand that we don't do things unless it's based on evidence. So we have something to teach each other. And I think that's the most important thing. We have to hang on to our workforce because it's dwindling relative to the growing older adult population, which I'm quickly entering. So I want there to be lots of nurses when I'm the one in the hospital. So we need to nurture our young for sure.
I love that. So well said. I completely agree. I feel that we all have a role to play in supporting one another and empowering each other. And I really think that that's going to be the future of how we can improve, nurse retention, nurse burnout. It's really doing it together. So thank you so much. Speaking of that, thank you so much for supporting us and kind of sharing all of your incredible wisdom with our audience. It's so inspiring to hear about your journey and all of the incredible work you're doing, both in research and innovation. So congratulations on an incredible nursing career so far, and
Thank
thank you
you.
so much for joining us.
I appreciate it. Thank you.